C-section is typically 48 to 72 hours. We're watching for infection. We're making sure that mom is stable enough to take care of baby. Just because that is a major abdominal surgery, you do get a little bit more time in the hospital because we do want to make sure that you're stable enough, you don't have any signs of infection, and that you can hopefully get up, walk around, take care of the baby.
We want to empower you to make fully informed choices about your pregnancy and parenting options. Let's talk about what's next now that pregnancy has entered the chat. Welcome back to Pregnancy Has Entered the Chat. Today we have Kyndle Connell on the podcast. Kyndle is a mother-baby nurse and a faithful volunteer at the Pregnancy Network. Kyndle's passion for serving women shapes who she is and what she does on and off the clock. With her experience working in postpartum care, she provides an invaluable perspective to the women we serve on equipping themselves for what happens after we give birth. Kyndle, welcome to the podcast.
Thanks for having me.
Of course. I'm super excited for our conversation today, too. So just to start us off, how did you get into mother-baby nursing?
I got into mother-baby nursing when I was actually in school. I started doing a lot of volunteering. Here, I started seeing the need of the education that women needed. And that they needed not only for themselves, but their babies. And then the Lord truly got a hold of my heart and I applied, I got it, and I have loved it since. I love that I get to love on the babies. I love that I get to teach mom what she needs to know and make her feel equipped, which is why I'm just so passionate about having, women feel equipped to take care of what they have.
That's awesome. When I emailed you, I almost included, I think that mother-baby nurses are angels on earth. Oh my goodness. You guys rock. Like, seriously.
We're like the date's place to be done with your baby.
Yeah.
What do I do? I change a diaper. It's okay, we got you.
Exactly. And my son was born. He had one diaper change that literally took 20 minutes. And we called the nurse in because we were like, what's going on?
And we know they start to changing diapers. So, but that's what I love about it.
Yeah.
All is that. Yeah.
Yeah. And you're so appreciated, so needed. But I wanted to know, what's your favorite part of your job?
My favorite part of my job is getting to educate moms and their families and seeing the light bulb happen. Whether it's talking about how to eat, even things like diaper changes, but also helping mom understand her body because her body is changing. And, she's just carried this child for 9 months and now baby's out, but she's feeling all the feels. And it's good to help women. I love helping women in that setting because then the more knowledge they have, they're more equipped. And the more equipped they are, they feel more confident in carrying out. And then they take great care of their babies, their families. And that's what I really love the most.
That's awesome. I'm sure that is really rewarding, is to see, like, whether it's the start of, this is the first kid, a start of almost like a brand new family, or just like watching the family evolve and change.
Oh, yeah. And like when they first come to us and, she's holding her baby, she's like, what do I do with this thing? And then by the time they leave, they're like, I got this. So look at me swaddling that baby. You just see that light bulb, that confidence. And that's what it's about.
That's really awesome. What a gift to get women out of fathers to just the confidence to take care of their kids.
Absolutely.
So getting into the kind of more details of the postpartum experience, what can women expect directly after they give birth?
Directly after they give birth, they're still going to be in labor and delivery. After baby comes out, if baby doesn't have a lot of complications, baby's going straight to mom. We typically put baby right on mom's chest. And for the first hour of life, that's where we want baby. That temperature helps regulate the blood sugars, helps them bond well. It also gives mom that sense of bonding that she gets to experience with her baby. While the rest of the team is working on getting mom stable after she's given birth. After they leave labor and delivery is when they'll come down to postpartum. And in postpartum, we're going to get them, assess mom, assess baby, and see what all they need, what education they need, and all that. But I will say the one thing that moms need to expect after they give birth is what we call the tummy feel.
Yes.
Or we're going to rub your belly.
Yes.
It's not delightful at all. But what we're doing, the reason we're doing this, and after you give birth, you do it for every 15 minutes for like an hour, typically. Every hospital is different. But what we're feeling is for that fundus or your uterus, we want to make sure that it's firm. We are wanting to look out for any type of hemorrhage. Whether, we don't want mom to bleed out. We don't want to, we want to make sure that all the placenta parts came out.
Yeah.
So what women really need to expect after birth are those horrible little, I'm going to rub your belly now. It hurts, but we are really making sure that mom's not at risk for hemorrhaging. We want to make sure that that fundus is firm, and if it's what we consider boggy, they could have a hemorrhage. So that is one of the big things to just go ahead and brace yourself for, is that you're going to have your belly mush on and pushed, and it's for your benefit. Like, yes, I don't even like doing it, but
I know. Well, I had heard about that, and I was nervous because I was like, it's like the unwanted belly massage after you just had like such a, like your belly is so hard when you're pregnant, and then all of a sudden someone's just pushing against your belly.
Yeah, it's not comfortable.
But it is for your good. So that's good for people to know. You can just speak about it. And also, you don't really care. Like, after you just gave birth and you've got this brand new baby, you're like, do whatever. Like, I just went through, I'm like, I can do anything. I just went right this whole labor experience. So, yeah, if you're listening and you're nervous about that, you've got totally fine.
Yeah, exactly, mama.
Yes. So, how long do women typically stay in the hospital after they deliver?
It depends on each mother's case. If you have a vaginal delivery, you're there anywhere from like 24 to 48 hours. Obviously, make sure you're stable. Your fundus is where it needs to be. You're not bleeding, or you're not passing really big clots. C-section is typically 48 to 72 hours. We're watching for infection. We're making sure that mom is stable enough to take care of baby. Just because that is a major abdominal surgery, you do get a little bit more time in the hospital because we do want to make sure that you're stable enough, you don't have any signs of infection, and that you can hopefully get up, walk around, take care of the baby.
Yeah.
So those are the kind of things you're looking for.
Awesome. And you kind of typically maybe have a little bit of a say if you have like a vaginal delivery and like you're ready to go home the day after, or you're not ready to go home.
Yeah,
that's the case.
We always ask our mamas, like, hey, how do you feel going home? Are you comfortable? And it's okay to not feel comfortable going home.
Yeah.
A lot of women want to stay an extra day just for the education.
Yeah.
Because especially as a first-time mom, even we've had moms that have had like 3 kids and they're still like, it's been a while since I had a newborn.
Yeah.
Part of my job is making sure, do you feel good going home?
Yeah.
Do you feel stable? Do you feel like you can take care of your baby? What else do you need from us? Do you feel like you can feed baby okay? Do you feel like you can get up and move around okay? And there is no shame in saying, I need another day.
Yeah.
So we've had women on the floor for that 72 hours before, but they walk out feeling comfortable.
Yes.
You know what I mean?
Yeah.
So,
and that's what's most important. Like, that's what you guys are really there for, just to equip them with everything that they need. And the hospital has so many resources, which we'll get into a little later, but it's so good to take advantage of those while you're there.
Yes.
Okay. And again, with the kind of nitty-gritty details, what does the hospital provide for postpartum recovery?
Lots of things, and it's okay to ask for them. We supply them when they come down to postpartum. They'll be at like tux pads, a lot of not so much C-section, but like if you've had a vaginal delivery, some women tear, and tears are the worst. Sometimes they just hurt worse than birth. But tux pads, which are like they have witch hazel on them, which are really soothing. We give them ice packs, we give them sitz baths, we give them a peri bottle, which women can put warm water in it and wash down, so you don't have to wipe after you've given birth because it's so tender and there's a lot of pain down there. For our C-section moms, we also can do an abdominal binder, which really helps. And then the other thing we do for a lot of vaginal deliveries is the dermaplasm, which is like a numbing spray, which is really helpful. You get pads, and typically, even for baby, all the supplies you're going to get are diapers, wipes, formula if you need it. So typically we'll send you home for at least a couple days worth of stuff. Like, okay, I could do this. But typically all those things, pads, witch hazel, those little, tux pads, Dermoclast, all those kinds of things.
Yeah. So, which is awesome because you could technically just kind of show up to the hospital and you would, like, even if you didn't have
the perfect hospital. Your bag is not checked. Come on. Yeah. You'll be fine. Yeah. You'll be fine. I mean, I've even gone to find like clothes for patients before. Oh, wow. So we've had that happen. You know, we've had people get trying to get to the hospital, and we still are able to find her clothes. Baby's got all that they need. And sometimes babies just come faster than mama's ready for it. Yes. So we have everything you need. Come on, don't worry about it.
Awesome. And then what is one common misconception about recovering from birth?
I'd say there's two. One is that a lot of women think that they just undergone birth, that's the most pain they're going to feel. When really after birth, mom is still going to be in pain. And so one of our things that we do is we constantly say, hey, mama, how are you feeling? How much pain are you in? And us nurses love the member system. You know, a scale of 1 to K. How's your pain? And where's it at? What we're trying to do, though, is stay ahead of the pain, because if we can reduce your pain, you can get up and move, which is better for your body in the recovery process. So the more ambulatory you can be, the better off you're going to recover from birth. So I think one of the things is that a lot of women just think when they come down to mother baby, you know, they're like, I'm fine. Like, no, girl, you just gave birth. You're in pain and it's okay. Like, but that's just one of the things that a lot of the women that we treat don't want to say, that they're in pain.
Yeah.
And I think that's something that needs to be addressed. Like, we're here to help you. We want to stay on top of that pain, the pain medicine to get you, whether it's just Tylenol or Motrin, just to help you get up and, you know, be able to take care of yourself. You'll recover faster.
Yeah.
And the second thing I would say is that people think that when they first come down and we're learning how to latch baby on, baby might not be wanting to eat, may not latch well. I know, like you and I talked, you know, it was difficult for us in the beginning.
Yeah.
But what moms need to understand is that just the way your baby latches within, even if it's the first 2 or 3 days, that's not your breastfeeding journey yet at all.
Yeah.
And so use lactation support, even if you're not going to breastfeed, even if you're going to bottle feed, because they can assess baby's sucking reflexes, palate. Use that resource, because even if you're going to, you know, bottle feed your baby, it might be a certain type of nipple that baby needs.
Yeah.
We've seen that too, where mama didn't want to breastfeed, and that's okay. But baby was still struggling eating.
Yeah.
Use lactation. You know, I feel like a lot of people think that that's just for breastfeeding moms. It's for anyone.
Yeah.
Or even if you're wanting to pump and feed, let them come in, let them assess you, let them size you, because that's a big part of pumping.
Yes.
They need to size you. Everybody's different. Everybody's equipment is different.
Yeah.
And so let them help you feed your baby, because that's important. Whether you're going to breastfeed, whether you're going to bottle feed, formula feed, whatever.
Yeah.
That's something that people don't take advantage of. And I always advocate for my patients, let patients see you.
Yeah.
To help you, your equipment, and baby feed, regardless of how you're feeding baby.
Would you recommend, like, on that note, if someone got a pump through their insurance, to bring it to the hospital and just say, like, can you help me figure out how to use this? I feel like there's so much about feeding baby that just feels daunting in the beginning.
Yes.
And you've also just been through, I mean, your hormones are all over the place. All you want is the baby fed, nasty.
That's probably the number one education we do a lot of is, yes, you have lactation. But I know myself, like, I've been in that bed when it just wasn't working. You know, my daughter was not I wanted to breastfeed and she was not having it.
Yeah.
But using lactation, but also your mother baby nurses.
Yeah.
Like, we've been trained. We may not be, you know, have extensive knowledge as a lactation consultant, but I can at least, hey, let's check baby's latch.
Yeah.
Whether it's something where his baby's not, you know, opening wide enough, or sometimes we can assess, you know, I don't know what it is, but baby suck reflex is not good.
Yeah.
So allowing, you know, both lactation and mother, you know, the nurses to assess that. Let us be your help in that setting.
Even just for the encouragement piece of it. You know, you might see, you know, check on things and you're like, you're doing better than you think you are. You know, like, you haven't had this experience yet and you see it, you know, whatever, in TV or the movies or whatever, and moms are just like effortlessly sitting there feeding their baby, and you just need that reassurance. Like, okay, this is normal. Baby's sleepy. I'm sleepy. Whatever it is, I think as like such an underutilized like resource, even just for that reason.
Well, and a lot of people think that, baby's going to come out and baby's going to eat right away. Actually, baby's good for the first 24 hours because baby's been inside the womb.
Yeah.
They've had amniotic fluid, all those things. So they're fine. They don't have to eat as much as we think they do.
Yeah.
And then a lot of women worry, oh my milk hasn't come in. Still put the baby to the breast.
Yeah.
If you're wanting to breastfeed, still put baby to the breast.
Mm-hmm.
If you're not wanting to breastfeed, that skin to skin is still good for baby.
Yeah.
Helping with bonding, blood sugar regulations, all of those things. So it's very important just to bond with your baby, regardless of how you're gonna to feed.
Yep.
Yeah. Mm-hmm.
Awesome. How does your experience as a nurse influence your interactions with the women we serve here?
There's lots. I'd almost say it might be backward. I feel like it's starting here and learning all the resources that women have and taking it to the hospital and saying, hey, about the WIC program? Hey, do you know about this? Has really helped me. And then even, learning about the hospital's resources, what they have to offer, and pulling it back here has been really neat. So I'm all about resources. I love that those two things in my job and as me as volunteer here can collide. I want to see women succeed. I want them to feel confident in raising their families. I want, them to feel successful.
Yeah.
And it's okay to say, I need a resource. I need resources. We all need resources.
Yes.
Yeah. And even things like the WIC program or helping them get set up. Because a lot of them come in and they don't know, they haven't been here or they don't have anything, and they're like, I can't be, or I can't breastfeed, but I need to have formula. How do I get it? And so that's where I see it. And I will say, adding on to that point, talking about resource hospital.
Yeah.
Lots of people come visit you. Social worker comes to visit you. That is your best person to ask for. Hey, I need help supplementing my kids. Even if you've got a large family and you need help with groceries, that's what the social worker's here to do. She's there to say, oh, great, let me get your, some groceries to go home with you.
Yeah.
Something like that.
You've got both sides. Like you can kind of come back and forth and be like, do you know about the pregnancy network? We've got a case manager on staff, she could help you with these things or here, like, oh, when you get to the hospital, you can do this. Like that is really like an invaluable piece of experience that you have that you can bring here. And on the WIC note, we did do an episode with someone who works for the WIC office in Greensboro. So if you're listening and you're interested, go back and watch that episode. But it was really encouraging to hear her share about it because she was saying like, some people are hesitant to seek resources for whatever reason. And, both of us said like, we all need resources. Like there's always a time in your life where you're going to need more or less help.
Yeah.
And the truth is with all these resources, especially government resources, like we've all paid into them. If you need to use it for a season or for, I think it's newborn or pregnancy through 5 years old if you're a mother of, a baby in the womb and then up to 5 years old. I think that's what the range is there, but use it, everyone is there to help you. Everyone wants to see you succeed. So
and that's why we're here.
Yeah.
We're here to help people. And a lot of these organizations want to help, people, women and children specifically, like they're there to help. But I think our society almost has this thing of, I don't need to be helped. I can do this. But we weren't meant to do it by ourselves.
Exactly.
We're meant to be with others. People are supposed to come around us and help support us. Even like when I see, ladies here, and I'm telling them about different churches they could even get support from. I'm like, there is nothing better than some lady showing up from your church with a casserole. Yeah. Girl, you just gave birth. Some lasagna.
Yes.
Thank you. Or someone just shows up and says, let me watch your kid for 5 minutes while you go shower.
Yes.
Showers are amazing.
Oh my gosh. Is that like I don't have it. Yeah. A daily shower. If you can get that, you'll feel like a new woman. Like if you're just like, okay, my remedy, sit in the bouncer. I'm going to go get in the shower. Like that is the best thing.
Absolutely. I don't have a rabbit trail there, but
yeah, it was a worthwhile rabbit trail. What would you say to someone who's scared to give birth and for what comes after?
I would say I was that person.
Yeah.
I was terrified. But I also had my daughter during COVID when everything shut down and there were no resources. I will say, we have this fabulous thing called Google, and I have all the internet, just familiarizing yourself with what to expect in your labor delivery process, what to expect after that, what to expect when you're down in mother baby. Other things to even look at is things that baby will have, the certain tests and screenings that baby's done. There is like an hour of time when they typically take baby out of the room. Take a nap. Yeah. Girl, take a nap. Things like that. Yeah. But I would just say, pray about it. Also, use your resources. There's wonderful classes. I know the Pregnancy Network has a lot of classes that we offer for people listening. Do the pregnancy class. Yes. Even the early and I'm all about even the parenting class. Yeah. Like we all need to be refreshed. Yes. I'm still figuring it out. I need the fancy class. I would just say just surround yourself with information so that you can make a decision that empowers you and family. But yeah, I can definitely say that I was that scared one and just didn't know where to go. And that's why I'm so thankful to places like this exists so that women could come and get the education, the information that they need, and then it helps equip them to feel better about the situation. Because now looking back, it really wasn't that bad. Like things can happen. Yeah, but I was like, okay, I'm okay.
Yes, but and I love that you said get equipped with all the information because I think there are those people where they just don't want to know and they just want to walk in and hear it. That's cool.
And if that's you, go, girl.
Yes, exactly. But I think for most of us, we feel a little bit more in control when we have that information. Yeah. I think just knowing what does the general labor process look like? What are the pain management options available to me? What can I ask my nurses for? Whatever it is, that will just make you feel so much better, especially when you've never done it before. So
yes. And along that note too, if you have had OB care, prenatal care, and you know that baby might need some extra support when they're born or things to look at, go ahead and ask those questions. Okay, when baby's born, what is baby going to need? Who's going to come see baby? Is baby going to go to NICU? Is baby going to get to stay here? Because a lot of times women, that was where I see women get really nervous is when there's a condition that's already known or baby's going to need some extra support.
Yeah.
And it's just very daunting. You're thinking you give birth, and then baby's over here on the warmer, where's baby?
Yeah.
So those would definitely be times ask those questions. Hey, what should I expect?
Yes.
And things.
Preparing yourself ahead of time.
Yeah.
Super helpful.
And even if you've got a healthy baby on the way, what can I expect if something doesn't go well? Those kind of things.
For sure.
Mm-hmm.
And then we touched on this one a little bit, but if there's any other resources other than lactation that you think are underutilized for postpartum women, what are some of those?
I think lactation is just the biggest one that's underutilized. People don't want to ask for it. Social work is another one of those, which we always send people in. And your social worker that sees you, if you haven't had the chance to apply for pregnancy Medicaid yet or WIC, that's your person to ask.
Yeah.
Those kind of people are important that play the biggest factor, I feel like, in mother baby care. And then there's also a couple people that come in, we call them a nest nurse, just to make sure you have everything that you need when you go home. But also verbalize to your nurse, hey, I'm concerned about XYZ going home or whatever it is, because we can also find those additional resources for you. So those would be, I think, lactation and social workers are probably the big ones that get just not used enough of.
Yeah.
That I love to be hey, go talk.
Yes.
This kind of things.
No, that's awesome. So what is your why for serving people in the capacity that you do?
I always think about the example that when Jesus was washing his disciples' feet, I want to wash the feet of people. I want to be the hands and feet. Even when I'm sitting with clients here, and I'm sharing these resources, we're not meant to do this alone. So my why is because Jesus didn't leave me alone. And I want to help women, help their families, whatever can equip mom, baby, family to go on a better path is my why. But ultimately, I want to shine the light of Christ. I want to be the hand and feet of Jesus. And this is just a great way to do that. And I definitely encourage anyone who's interested to come help out the pregnant family. Yeah, it's great. I love to see the women that come in and just walk out a little taller. They just feel like, hey, I got this. Mama, I got this. Yes, she's equipped. I would say that's my why.
That's so beautiful. And I completely echo that sentiment at the end of my favorite moments here are when I'm like coming in late for something, or I'm just out in the parking lot for some reason. I get to watch women walk out, and it's just the most rewarding. Like, and it's, if you come for an appointment, you're still a little money weave, totally normal. But I've seen people walk out with their ultrasound photos, and they're just beaming. They're just so happy to have gotten like, not a little,
just out of breath.
Yeah,
they come in holding their breath, and you like to see them walk out exhale. Like, yay! So yeah,
it's just such an apt example of the washing of the feet that Jesus did, because mother baby nurses, they're going to be really your best friend for those 2 days that you're there. They're going to get to know you really well, and I just think that Jesus was just so servant, and I think nurses are so wonderful at serving the people that they do. So thank you for what you do.
Oh, thank you. I love it.
Yeah, and thanks for coming on the podcast today.
Thank you for having me.